Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I am interviewing Dr. Cody Dimak, and we're dissecting active rehabilitation and different models, right? Not just having a rehab space or a clinic gym. What if you don't? What are some things to consider? How to connect with other trainers, best practices around at-home exercises, and really implementing this into your practice, no matter what your model is. And he does a great job of dissecting that out. Before we dive into that interview, I do want to make mention, we got back a couple weeks ago from our East Coast Mastermind where we had the Scheduling Institute come talk about case acceptance or, the sales process, but really in a bigger picture, the overall patient experience. And I also was in London and talked and did a whole masterclass on patient experience with Dr. Chris Chippendale. And one of the things we didn't talk about in there, and it's a conversation that is always needed, but wasn't necessarily pertinent for the London masterclass or when we were in Maine for the mastermind, but that's what your office space looks like and is, and what role that plays in the patient experience. And it oftentimes is a bigger role than you expect or realize. And it doesn't necessarily mean you have to have the Taj Mahal as an office, but there are certain strategies of flow, of design, of decor that really do make a difference. And so one thing you should just look into, they got a lot of great resources, and that is Crossfields, Interiors and Architecture. I used them back in 2022 for my practice. And you can go to crossfieldsdesign.com to check out more for your office space, whether it's a new build, a remodel, a moving of space, a touching up of decor. They got you covered. So check that out. All right. So with our interview today with Cody, we really talked a lot about really active rehabilitation. I had my first experience with learning from Cody at the MPI Sports Summit, and we talk about that a little bit earlier this year. And it just was really a really good presentation. If you ever get an opportunity to hear him speak, he's very dynamic, brings the goods, and has a communication style that is effective, and then actually coaches you on how to coach people on exercise in particular. And we dive into that a little bit today. So excited to have him on the podcast finally and dive into that. So without further ado, here is my interview with Dr. Cody Dimak. All right. Excited to have Cody Dimak on the podcast today. Kind of laughing into it as we go. He gave me a pretty visual. I won't brief you on it, but welcome to the show, Cody. How are you, man?
I'm doing great. Doing great this morning. How you doing?
Good. Doing well. Let's dive in. Tell us a little bit about yourself professionally, kind of how you got going, some of the background on it, and what you're doing now.
Yeah. So kind of right out of chiropractic school, my future at the time future wife, now current wife, and I ended up doing a CBI in California. So we ended up moving to California, and I'm from New Orleans originally, and my wife's from South Dakota, so we didn't really have any ties to California or anything. She just wanted to go experience it for a CDI, just to say she did it. And then she ended up falling in love with Huntington Beach when she was out there doing that. So we ended up moving to Huntington Beach and started the practice in Costa Mesa, California, which is like one little city over, right next to Newport Beach. And so we were out there for about 7 years, and we started an active care practice out there from scratch. And again, not knowing anybody in a big world out there. And being the business guy you are, you'll appreciate this. After we did our build out, we only had 3 months of working capital to work with on a 5-year lease. So you had to make it happen, and we did. We made it happen. We went out there and we kicked some butt, and we kind of got to a point to where that lease was up. We're doing really, really well. Got to a point to where our lease was coming up, and before the time came to renew our lease, like whenever something happened in our practice, we sat down, we kind of wrote out our goals. We met twice a year to kind of make sure we were moving in the right direction. And like if a door was closed, the next one would open, and that would be the one that we needed to go through anyway. And
Hmm.
that even started with like looking for an office space, right? Um, but we were looking at all these other spaces, and like just nothing was popping up. Nothing was kind of like coming to fruition, if you will. And so we sat down again. It was that time of the year. Sat down and kind of wrote out our family goals, our practice goals, and we always made sure those were lining up where we wanted to go. And we noticed that they were starting to kind of move away from each other. So where our practice was going, and where we wanted to go with our family and what we needed to do with our practice to keep that going in the direction, they were starting to move away from each other. And so before we started the whole thing, we made a promise to ourselves, like, family is going to be first for us, right? So we made a decision to move back to the central time zone. And so at the time, it did make sense to start another practice.
Hmm.
Um, but we wanted to, wherever we were going to be, we wanted to be driving distance to family. So we could at least drive to South Dakota, at least drive to New Orleans to see family.
Hmm.
And instead of like a flight, or like the drive is just not feasible. It'll be over 24
Yeah.
hours. Right? So, yeah, we started doing that, and we started looking for teaching jobs. And so the
Mhm.
only place at the time was hiring was Parker University. And so I ended up applying for a clinic faculty doctor position in the clinic. I ended up getting that position. And then, in May of 2018, we ended up closing our practice in Southern California, moving to Dallas, and that's where we're currently at now. And so we both currently teach at Parker University. I've started in the clinic, but then I transitioned into academics. And so I
Mhm.
currently teach it's called Physiotherapy 2, which is the active exercise course in the program that everybody gets. And I also teach an elective called Advanced Rehabilitation, where we kind of dive into more concepts of like deeper concepts like McKenzie, DNS, neurodynamics, strength and conditioning. And the idea of that course is to kind of get the students a little bit more exposure to some of these things
Yeah.
to try and make them take the coursework essentially, outside of the program and stuff because I think those things are invaluable. We also go over like a lot of like strength and conditioning and kind of teach them how rehab is actually not it's a separate thing from strength and conditioning. It's just all scaled to the individual and then where that person is in their current state. You know what I mean? So that, that I kind of brought this up, I think back in March when we were in Florida,
Yeah.
it just finding the entry point for patients is kind of like a big deal. You know what I mean? For me anyway. And people see these two things of like, exercise and strength training and rehab as like these separate things. They're not, they're literally the same thing. They just have a different name for it. Right. So
Yeah.
teaching people how to, the students in particular at Parker, to try and scale things for their future patients is kind of like the goal,
Mhm.
the end goal anyway. So
Yeah, no, it was great attending the MPI Sports Summit when you were speaking on that. And that was kind of where I know we had played golf and we had chatted, and I was like, I want to get you on the podcast. I took a little hiatus from interviews, so we're getting to it now. But I was like, whether it's strength or it's rehab, however you want to work on the continuum, practices need to have some form of implementation of that. And I wanted to have you on today to discuss, kind of what that looks like, right? We get some people where it's a huge part of what they do, right? In their practice, they got a well-developed rehab area and it's a big part of their care. And then you got other practices where they don't, but what they can do. So I kind of wanted to dive into that today.
yeah, totally.
Chiropractors, if your website traffic or Google Maps visibility has felt a little unpredictable lately, you're not imagining it. A lot is changing behind the scenes. AI is reshaping how search results show up. Competition in the map pack is getting tougher, and simply ranking well does not always translate into new patients. That's why Propel Marketing and Design is hosting a free chiropractic SEO workshop. You'll learn what's actually changing with Google Maps, how AI is impacting the way patients find and choose clinics, and what small, realistic updates you can make this year to stay visible and competitive. This is not a high level talk or a bunch of jargon. It's a practical step by step workshop built for busy clinic owners who want clear direction and next steps they can actually implement. Save your spot for free at propelyourcompany.com/MCM SCO workshop 2026. And we'll see you there. What are your thoughts on kind of that? strength, rehab continuum, like where obviously putting people on there, but what from the DC's perspective, what are a couple nuggets they should be thinking about in regards to that?
Well, I think one thing that every DC needs to know and understand is like where are they at in terms of like knowledge and comfort on the topic, right?
Yeah.
So if we step back even from that question, there's no denying the benefits of exercise and strength training. Like you can't deny it. Like
Yeah.
it's you know what I mean? Not just like for ourselves as well, right? And for our
Mhm.
patients, you know what I mean?
Yeah.
So it needs to happen
Mhm.
some way, shape, or form, somehow, some way. It needs to happen, right? And I think one of the things that DCs can kind of like, you know, take a little bit of like worry off for the back, if you will, is like you as a DC in your practice, you need to do what you're really good at.
Mhm.
Like your gold medal, like whatever your superpower is, you leverage that and you lean into that, right?
Yeah.
But knowing that the strength piece or the rehab piece is a key piece to that, and so one of the things that, because I'm not ignorant to the fact that not every student that I teach is not going to integrate active care into your practice, but how I frame the course is regardless of what you think you're going to do in practice. And we have this conversation. There's no denying the benefits of strength training, especially for your patients, right?
Mhm.
If we're talking about actual long-term health, you know what I mean? But if that's not you doing the work in your office, then if you have the office to do this, you bring somebody else in there to do that. And you co-manage
Mhm.
within the office and you're making money and like all these things, right?
Yeah.
If that you don't have the space for that, then you need to find somebody in your area who you can co-manage with, right?
Yeah.
Is it a PT? Is it another chiro? Is it a strength coach? Is it is it a personal trainer? Like what does that look like, right?
Mhm.
And then you co-manage that case. And it's like you can, but the whole piece of this is like, it's not centered around you. It's centered around the individual in front of you. It's person-centered care. And then at the end of the day, that's what we need to be providing regardless. It's not technique centered. It's not doctor centered. It's person centered. You know what I mean?
Yeah.
And so the docs who are really good at adjusting and they don't feel like they're good at soft tissue or exercise, get somebody who's good at soft tissue and exercise. When we were back in Cali, there was a chiropractor, like you can throw a rock and hit a chiropractor in any direction.
Yeah.
But I had this, there's an upper cervical doc that was like not even a mile from my office. I get a call one day and he asked, he said, "Hey, I hear you hear about other
Yeah.
professionals around the area. He's like, I hear you're really good with exercise and rehab and stuff. I'm struggling with a patient. Would you be open to assessing the patient and seeing what you think should be done from a soft tissue exercise standpoint? And but let me do the adjusting." And I told him, "Yeah, sure, absolutely.
Yeah.
Like I put my ego aside. I'm like, I don't care. You know what I mean? Like I'm here for the person, right?"
Yeah.
And we got like, the guy had treated the patient for probably about like a month or two or something like that. I can't remember the specific details. And then within like 3 visits, they started like getting better really quickly. He
Mhm.
was like, "This is great." And we ended up co-managing over 10 patients together,
Yeah.
you know?
Yeah.
So like you can do it with other, people, even within the profession, you know what I mean? You
Well,
just have to find
yeah.
the right person
I want to
so
touch on that for a second because it's something that I've talked to some of our coaching clients before on it, and it goes often missed is that what you should do in your community is look at the other chiropractors and what are they offering, right? Like
yeah.
example, like maybe you offer Shockwave, and I had a chiropractor who was a straight chiropractor, right? Like you mentioned, and he came in to see me for ART in Graston, and then he noticed we had a laser, and so he started sending people over for laser and that was great. And then, the joint is in everybody's area now, and they don't take complicated cases. And so, if you do active rehab and take on complicated cases, you could be a resource for them to send complicated cases to,
Yep.
right? So, I think that's something that you got to take into consideration. Or, like the opposite, if you don't do any form of active rehab, you could connect with other PTs or even chiros that do it and
Yep.
refer. And you obviously want to work. We had a patient recently where he's coming in for shockwave, but he sees a chiropractor for years that he likes for adjustments. I was like, all right, we're not going to do that, right? I'm not going to step on their toes and I let them know. It's like, yeah, let that chiropractor know you're seeing us, but we're not going to do the adjustment. And having
Right.
communication around that, I think you can co-manage rather uniquely in your community.
Totally. Yeah. Like you gotta find the right person, right? Because not everybody out there is quote, good guy, you know what I
Oh
mean?
yeah,
Or
for
good
sure.
gal, you know what I mean? There's people who do try and leverage themselves like that, and then they kind of like they pull the rug out from underneath you. So you always have to have that. I tell the students you have to have a bullshit meter. You know what I mean? And that's
Yes.
I mean that not just you know within the continuing education space and the seminar space and these these people who are like these charlatans essentially, right? But also within the profession when you're co-managing people in other professions as well. So you always need to kind of try and pick up on those things. And you could usually you get the vibe, you get the vibe from them and you just move on. So
Yeah. No, without a doubt, without a doubt. Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years, and that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. You know, when you make a big investment in something, you want to see a return, and we're seeing that return in clinical outcomes and in our investment, and that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately. Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to KeenestMedical.com, KINAS medical.com, mention MCM podcast and receive a free shockwave in practice book with a purchase of a unit. So that's KeenestMedical.com, KINAS medical.com, and mention MCM podcast. I want to get your thoughts on, your chiropractor that you do adjustment soft tissue. You don't do any form of active rehab in your practice, but you want to maybe you feel good about prescribing it. You got a particular platform where you can put it on there. They can do it at home.
mhm,
What are some of the best practices with that? Because obviously, we could all admit that um, at home exercise prescription is probably not followed as much as we would like it to
totally.
be.
Yeah.
And yeah, like I was on a thread in Facebook recently, and it was about frequency of treatment and duration and all that type of stuff. And then
Mhm.
I had mentioned that under treating is probably just as bad as over treating sometimes
Totally.
in care. And someone had mentioned, well, it depends on how much you're prescribing at home care. And I didn't respond back. I was like, well, how many people are actually doing at home care
Yeah.
as well?
Totally.
We would love for it to be, but what are some of your best practices on that model?
Yeah. Wow.
I know it's a lot.
Yeah, as simple as a question that is actually a much more loaded question than you would think. And specifically because it's not just about how many exercises you're giving. But no, um, it's more loaded than you would think. So it's not just about how many exercises you prescribe, because that's immediately what people jump to. You know what I mean? So like I don't know if you've ever had like formal active rehab for anything with a chiro or a PT, and you get the packet. You get the low back
Mhm.
packet, you get the cervical
Yeah.
spine packet, you get the shoulder packet, and those packets have anywhere from 10 to 20 exercises that you're supposed to do either once a day or like 3 times a week. And it's uber high volume. And you look at it as like, there's not a chance in hell I'm going to end up doing this. Not a chance. I think even me, you hand me something like that, I'm not doing this. Right. Especially somebody who's busy, and I'm not just talking about like your suit busy. I'm talking about your manual labor busy too.
Mhm.
Right. Like the people who are busy, they're not going to do it. Even if people have time, they look at it as daunting. It's
Yeah.
overwhelming. Right. So that does play a role. So, but I think other factors play a bigger role into this as well. So like, it does play a role in regards of like, I'm trying to give somebody one thing that's feasible for them to take home. Ideally, one thing, the one thing that's going to move the needle the most in their case, right? Especially earlier on. I'm not going to, if I have somebody, the only time I'm sending them home with more than one thing is if they're like an established patient, or if they're a patient where I know, like you already know their motivation is high for these things, right? They're like a 10 out of 10 motivated, and you can hear it in their voice. You can see it in their actions. And when they say it, you're like, okay, maybe, and they're competent movers, specifically, like meaning not competent, I mean like dysfunctional or anything like that. I'm talking about competent in terms of like they're willing to move and they're okay with moving. They exercise, like all these things. I might give them 2, maybe 3 exercises to take home, but they're only doing those once a day anyway, right?
Yeah.
And the dosage is relatively low. And we kind of do we do like movement snacks. So they don't like have a devoted time. They like, it's like eating throughout the day. You don't want to eat like one healthy meal and eat like crap throughout the day. You want, ideally, if you're gonna eat healthy, you space it out throughout the day, right? Same thing with those movement snacks, right? So like things that are gonna move the needle, kind of like just small dosages that are gonna keep pushing them in the right direction. But like even if they have one exercise, boom, one exercise once a day, always prescribe walking.
Yeah.
Always prescribe walking. That's a caveat there. I don't consider it home exercise. I say, hey, it's activity. Hey, you gotta walk. And then you'll start seeing people get better. But I think that your original question, again, like it's more loaded because how we coach the exercise actually matters. Because a lot of times we give people exercises and we say, hey, this exercise is to help you. It's going to help your back, or it's going to help your shoulder. It's going to help the pain in your shoulder. That doesn't mean anything to the patient. You think it does. It doesn't mean anything to the patient. Because if you think back, like people come in because they have pain, but that's not actually why they come in. They come in because their pain's not allowing them to do something they actually love to do, right? Is it golf? Is it, play with their grandchild? Like anything along those sorts, right?
Yeah.
You need to identify that first and then build everything off of that. Because if you identify that, then you start having goals, right? And you start setting goals. And one of the things that we do a poor job of in the profession is getting patients to actually set goals, set short-term goals, set long-term goals, and then moonshot goals too. Like what's something you think that you would never believe to do, but like once in a lifetime, you can maybe do it. That's a moonshot goal, right?
Yeah.
We get them to set goals. And then we get them to identify any fears and worries, because what you're doing when they identify fears and worries, you're identifying their barriers, right? We ask them what's their motivation to do some of these things. If we were to set programs or get with a strength coach or do things to start moving towards the goal, 0 to 10, scale 0 to 10, doesn't matter where they fall in that scale 0 to 10. If they're like a 7 out of 10, which is really high, say, okay, Miss Susan, why did you pick a 7 and not a 6? Why'd you pick a 7 and not an 8? Now they are identifying their own barriers. And once they identify their barriers, they can actually make the choice to do something different about it. We try and make people change. We can't do it. People have to make the decision themselves, but we can nudge them in the direction. It's called behavioral nudges, right? You could take somebody and try and change their nutrition plan, give them a hard plan. They're not going to follow it. Or you can nudge them and say, hey, when you buy your groceries, I want you to buy all your groceries from the periphery. Nothing down the aisle. And now they have to make healthy choices. You know what I mean? So like relatively healthy. So a lot of times the beer and the wine's not there too. So you got to be mindful of that. But we start getting them to identify their own barriers. We get them to set goals. Then our exercise selection is always explained according to their goal. Doc, I can't, I'm having low back pain. I can't, I need help. Okay. Well, what is your back pain not allowing you to do that you love to do? Well, to be honest with you, I can't get on the ground and play with my grandchild. I can't pick my grandchild up. Okay. You just identified somebody, basically what you would some kettlebell people would call a Turkish get up, or a variation of a Turkish get up, right?
Yeah.
And you just identified a hip hinge pattern, like a deadlift, right? Something to pick something up off the ground. And so if you're working on hip hinging exercises or glute facilitation exercises or anything like that, you can't just say, hey, these are going to help you. It's like, no, okay. Do you know how you're having trouble picking up your grandchild? Yeah. This exercise is going to help you get more into your hips. That's going to offload your low back so you can pick up your grandchild without pain. Oh, now there's a why to what we're getting ready to prescribe to them. So when you start coaching the exercise, the attention's there, right? And they do the exercise well, if you're going to send them home with it, you film it on their phone
Mm.
saying, and you coaching them with your finger there, and you give them the cue, whatever you're going to give them. We're not going to get into that stuff, but like you give them the cue and stuff. And then you say, okay, remember, this exercise is for what? And you have them repeat it back to you. This exercise that helped me pick up my grandchild. You got it. We just want to do this once or twice a day here. And then remember, we want to go for our walks here about 10 to 15 minutes, about 4 to 5 times a day if we can. If you could get one in, that's it. That's better than none. Sound good? Yep, cool. Stop recording. Now there's a desire, right? So that they talk back to you. It's a portion of the talk back test. They told you why they're doing what they're doing, right? And now again, now they're a little bit more accountable for some of those things, right? And it takes a little bit more understanding, I guess, of within the history and within like the actual individual in front of you. It's not just a pure biomechanical thing. So now we're kind of getting into the psychosocial components too. So it takes a little bit more from the chiropractor or any other profession for that matter. But honestly, that's how we get people to adhere to exercise programs. Students will ask me, docs will ask me, how do you get people to do exercise? Like, honestly, I've never had trouble getting them to do exercise. It's just like that. I haven't done the why, I didn't tell them why.
Yeah. And it's just, I feel like it always goes back to effective communication, right? I want to tell you about something my clinic has recently integrated because I think it's relevant to much of what we talk about on this show. If you're maxed out and can't take new patients, or patients are getting better and just leaving, you don't have a clinical problem, you have a systems problem. That's what P2P Pathway solves for you. It's a model that takes your patients from rehab into ongoing strength and performance programming inside your existing practice using Tonal's AI-driven equipment. No trainer required, no separate gym build out. The result is recurring monthly revenue that doesn't depend on how many patients you can personally see in a day. They run live seminars where they walk you through the entire system, hands-on, in person. Attendees also get exclusive discounts on equipment, including Tonal, that you can't get anywhere else. Seats are limited. The link is in the show notes. If you're serious about adding a recurring revenue stream to your practice, this is worth your 2 days. So check out www.p2ppathway.com. The one thing that on the communication side, I'd love to hear your thoughts on it. I recently had a patient. She's got a trainer and had a trainer for a long time. Awesome. And so I use that opportunity whenever I can is to say, hey, do you mind if I, reach out to your trainer and have a conversation about what you have going on, what I found, what maybe you're doing that's helping that, what things we could add. I always frame it as like, I want you to keep on working out with your trainer. I want to have a conversation, a dialogue, kind of as a team, like you can imagine, and not come at it as like, I want to make sure you're not doing anything dumb with the trainer, right?
Good.
It's more about like, what can we add or alter right now while you're dealing with this and have a team approach to it. And I found that to be a great level of care, rapport building with that patient. Obviously, it helps with their overall communication with their, let's call it performance-based and health people. And then, yeah, you end up connecting with like-minded trainers oftentimes. Is that something that you've seen work well? And any thoughts and strategies around that?
You know what? You just nailed my marketing strategy on the head. Honestly, and it's sad that it took me 2 years in private practice, full-time private practice, to actually realize this. That was like where my actually niche, if I had a niche, was from a marketing standpoint and networking. That we always did that. Most of my referrals came from personal trainers or strength coaches.
Mhm.
And if they were a referral from another patient and they weren't with a personal trainer, strength coach, visit, and if they weren't in like a lot of pain, you know what I mean?
Yeah. Mhm.
Visit one, I always asked them like, what were their opinions on eventually getting with a personal trainer, strength coach to that. So just kind of put the feelers out there, those things, and kind of like leaned into that as we progressed through thing when it was time to move it towards training and strength and conditioning. But yeah, every time I got a patient that came in who was working with a trainer who I'd never worked with personally before or communicated with, right? Yeah. I always got permission, obviously, from the patient to make that call with the coach, and I always went to their place. Sometimes they wanted to come to mine, but Like if they insisted to come into my office, then I'd have them come. But I always like that first interaction in the environment that they're comfortable with, right? And it's always a face-to-face conversation. So having those conversations, like you said, like you don't want to frame those conversations, especially if you know they're doing something that's kind of a little like iffy for what the person's doing or what they have going on. Or even if like you recognize that like their exercise order is not very great. And that's why a lot of their clients are getting kind of like, grumpy back or like, irritated shoulders. Like
Mhm.
there's mismatches of like exercise intention and like dosage or volume or like load, you know what I mean? So I always kind of frame those conversations with the coach or the trainer. I would never tell them like, hey, don't do this. Or like, I was like, let's say I had a patient who had like some sensitivity to let's say rotation and lateral shear or something,
Mhm.
low back issues, right? So I would always frame as like, okay, remember the patient, is the exercises that are going to be good for your client would be like X, Y, Z. Not like suitcase carries or like any type of rotational things. I know you wouldn't be doing those with the patient anyway, because
Mhm.
but and I'd go on to explain it. And I never pinned them, say, hey, you're doing this, right? I
Mhm.
say, I know you wouldn't be doing that because they have sensitivities to these motions. And that would always make them ask a question. We're like, oh, yeah, yeah, yeah. Well, what would you do instead?
Mhm.
And then it opens the door for an education moment without them feeling embarrassed, without them feel like shutting down. You know what I mean?
Yeah. Yeah.
And I think Marianne my wife would tell you that was kind of one of the things I did kind of well is like leveraged in the conversation of like an educational piece, but without like making them feel kind of stupid or silly.
Yeah. Yeah. It's
Um,
a fine line sometimes.
yeah. But one of the things too is I even even when I'm looking for new patients,
Yeah.
one of the things I always did was I called a gym that I've never worked with,
Mhm.
and I asked them to meet with the owner of the gym. And how I framed it, I always framed it as, "Hey, I'm a chiropractor in Costa Mesa. I have a patient basis that actually comes from quite a bit, quite a few different cities in Orange County, California."
Yeah.
And so I'm looking for gyms and personal trainers and strength coaches to refer my patients to
Yeah.
because I have to play matchmaker. So it's both like location and it's like personality type and type of gym, like what they like. I need a variety.
Yeah.
Uh, Nobody's ever going to tell me no.
Mhm. Yeah.
They want to know too, right? Because they
Yeah.
want client. They want people to come in. And
Mhm.
so we'd always go there and within the first like 5-10 minutes, if you know a decent amount about exercise, you don't have to be like perfect. Like you don't have to be like um, you know, a master in any stuff. You already know if the person kind of knows what they're doing, if it's going to be a good spot. And they always try and ask you questions about you. You can answer the question, but then you kind of come back to them. They end up coming in as a patient and then you do a good job with them and they end up sending all their clients.
Yeah.
Yeah. So
Now, in your practice, did you have a gym or was it just rehab that you were doing in your?
yeah, we had an open rehab area.
Yeah.
We didn't we didn't start out with a ton of equipment. We literally had like some Perform Better mini bands. We had some Gray Cook bands, and we had a couple kettlebells. We had an 8 kilogram kettlebell, a 12, 2 16s, 120, and 124 kilogram kettlebell. And then we ended up getting a this found on the garage sale was like this pull up contraction that kind of
Mhm.
acted really well for anchoring bands, right?
Yeah.
The five like right when we opened, we had like because we signed a 5-year lease. Our goal at the time, right when we opened, was to grow the practice and then eventually have to knock down the wall,
Mhm.
take over the suite next to us, and build the gym on that side.
Yeah.
But then, like I said, like 2 years into practice, I started realizing that all my patients came from strength coaches and personal trainers, and not just one, like a lot of them.
Yeah.
And I was like, if I do that, I'm going to cut my feet out from underneath me. You know what I mean?
So that's
They're
where I was
shifting,
kind of
you
I
know?
was leading you into this. Do you have any recommendations? Because we obviously have a lot of listeners that do have a clinic gym model
Yeah.
or hybrid. And a question I get oftentimes is like, what do I do? Can I still get referrals from other trainers if I have a gym? Like, do you have any thoughts on that? Can you still navigate it? Is it about, again, effective communication, not stealing clients, keeping them as patients in that regard? What are some of your thoughts on that?
Yeah, I think the to answer your question is always, and you know the answer is always the communication piece
Mhm.
beforehand, right? So the clinic gym hybrid piece is probably most effective in a particular area where there's access to gyms and conveniency of gyms is not very great. You know what I mean? So like having like your care and your gym in the same spot is like awesome.
Yeah.
If you're in a place like, let's say, Orange County or even Dallas, like
Yeah. Or
downtown
even where
Dallas,
I'm at here in Boca. Yeah. We got a
right?
ton of
Like
fitness.
that gets a little bit more hairier because you got to look at it from the personal trainer's side, the strength coach's side, right? They have a business too, right?
Yeah.
Um, and at the end of the day, it's not about us trying to, we're trying to help people.
Hmm.
At the end of the day, that's what we need to do. So there needs to be clear communication with strength coaches and personal trainers who come in as, who, it's like, hey, I am not stealing your clients. What we want is we want your clients to keep training. And I have patients come in, I want them to exercise as well, right?
Yeah.
If you send me a patient or you send me one of your clients, they're training with you.
Yeah.
They're training with you. And you are going to run into the unfortunate scenario that too, where their client, now your patients can be like, well, why can't I just train here? You know what I mean?
Hmm.
And so that's a conversation you'll have to navigate with
Yeah.
the patient, you know what I mean? But it can happen. I think you can do it. It's just like you have to build a good relationship with a strength coach and a personal trainer. So that, and it's kind of not the same, but it's almost kind of the same. Like we did a lot of work with Equinox while we are in Southern California, and sometimes we would have like, they would send us patients. One of the trainers would send us patients and then they would like switch trainers, and we know
Yeah.
both of the trainers. So it was always like this
Hmm.
weird space thing there too. So
Yeah.
it was always interesting to see like how some of those trainers navigated those things too. The
Yeah.
great ones they never got pissy.
Hmm.
Good trainers they never took it as a dig, and just what it is. It's what the person needed, and so they moved on, right? And then some of the newer trainers who had like bigger egos, they had issues with it, and
Yeah.
so
Yeah.
you always have to is it put the ego
Balance.
aside,
Yeah.
right?
Um, yeah, that's good. It's always tricky. It's something I always ask people, and that was similar to me. I've personally never wanted the gym model. Not that I don't love it, and I think it's great, but for me, I
Yeah,
just had too many trainers sending me, and it
yeah,
just was like, I don't want to bite the hand that's feeding me there. But last question is, obviously aside from your Parker duties and everything like that, and you and I got to officially kind of hang out and play golf at a seminar MPI. What do you got going on? You got any events coming up? Any seminars? I think you're doing some stuff with Ben Stevens. Is that correct?
yep, yeah. So I got a couple things. We got the big mastermind coming up with Ben Stevens. That's
Yeah.
the big one, looking at next year.
Yep.
Um, so that's going to take up quite a bit of time and space with some of those online lectures, and then eventually the in person portion of that. That's
Hmm.
huge too. I'm very very humbled to be included in that, because you look at the names on
Yeah.
that. It's kind of wild.
It's a bunch of clinical experts and then my dumbass.
Yeah. Well, again, I'm humbled to be on the list, and seeing like your name out there and all the others, it just kind of blows me away a little bit. So, very, very grateful to be included in that. So have that. We have, in a couple of weeks, we have, Tennessee Chiropractic Association has their annual event, the Southern Chiropractic Association. So I'll be doing, a couple hours there at their conference, 2 hours with the docs on Fridays, and I have 6 hours with the CTAs talking about exercise, the rehab, active care. And then we're doing, my wife and I are doing like first time we're doing like a co-seminar. So like we're both co-presenting a seminar. We're going to be in St. Louis. So we're doing one for, at a clinic in St. Louis. That's going to be in October, I think. October.
Mhm.
I should know the date of that probably.
Mhm.
That's going to be October, I believe. Obviously, we have Parker seminars coming up as well. I'll
Yep.
be speaking there in October also. And then, we'll look at it. We got a couple things potential lined up for next year as well. Maybe something in Birmingham at Bo Beard's place.
Hmm.
Haven't pulled the trigger on either low back or if it's going to be actually coaching, like teaching how to coach exercise, or my knee. I have a knee weekend knee seminar as well. So
Nice, man. That's
yeah,
exciting. And so hopefully we can cross paths here again soon.
it's gonna. We need to make that happen.
Yeah, no,
We need
definitely.
to
Is there,
we need to play golf with. I have my clubs instead of using like a smorgasbord of clubs there, and we need to get your. Did you get a new club yet?
I did, yeah. So I want to, brag a little bit about how much of a physical specimen I am and how
Yeah.
strong I am that I was hitting a 4-iron and I didn't even stick it into the ground
No.
and I snapped the 4-iron, and this is new clubs, new Titleist clubs.
Yeah.
Snapped the 4-iron in half in my downswing. I mean, that's how much power I'm generating at
I
46
mean,
years old.
I was like I was sitting in the cart and I can feel the ground reaction force that you were
Yeah.
and into the turf, right? It was you're right. You did not hit it too steep, right? We can't give
Yeah.
you the nickname of the sod father or anything like that. So it was true, like
Uh,
it was kind of crazy.
I
It was
I
loud.
I did bring it in to get, I actually joined a local country club here, and they have a club repair and stuff, and I brought it in, and I'm new to the country club, and I was like, "I just want you guys to know I didn't do this in anger. I didn't wrap this around the tree on the second hole or anything. This was,
Yeah.
it just broke in my swing." So,
Oh, that's great.
but yeah, it is fixed. It is fixed. So,
It's awesome.
um, where can our audience find out more? You got anywhere that you can send them, or if they want to be interested in some of these courses you got coming up?
Yeah, I don't have any like a website or anything like that. We're probably we need to get something going with that. I have an Instagram. Our old chiropractic practice, which we don't really post anything, was Max Perform Chiro on
Mhm.
Instagram. But so I created fake Max Perform Chiro, and I've just kind of kept that. So that's my handle on Instagram is fake Max Perform Chiro. Used to post satirical things on there. But it's kind of molded into like now, which is post professional stuff on there too. So, but
Awesome.
yeah, any updates and like courses and stuff like that will be posted on there. Sometimes we'll loop some things on Facebook as well. But no formal website with like things listed, which is, I know you can slap me on my hand later for that.
Yeah,
Uh,
we'll have a conversation later.
yeah, we'll get that squared away.
All right, Cody, this has been a pleasure, man, and we'll talk soon.
All right. Thank you. Appreciate you.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.